Hello, my name is Imran Baig. I'm one of the Interventional and Structural Cardiologists here at Connected Cardiovascular Care. Today's topic is atrial fibrillation. So atrial fibrillation is the most common irregular heart rhythm in the United States, affecting about 2.3 million adults. Its prevalence increases with age, with most of the patients being above 65 years of age. When you have atrial fibrillation, the left upper chamber of the heart starts quivering, where the contractility is affected. That leads to stagnation of blood, and usually there's a tendency to form a clot. When you have atrial fibrillation, your risk of having a stroke goes 5 times higher than the average person. And most of the clot, 97-98% of the time, forms in the left pouch. It's called the left atrial appendage. So your risk of having a stroke goes high with you developing atrial fibrillation. Atrial fibrillation can give you a variety of symptoms, but most likely you will have palpitations where you feel a fluttering in your chest. You can have dizziness, chest pain, a feeling of passing out. These are some of the symptoms that you can have from atrial fibrillation. The exact etiology of atrial fibrillation is not clear, but you can have atrial fibrillation from a variety of causes, including hypertension, history of coronary artery disease, if you have any valvular disease that involves mitral stenosis or mitral regurgitation, where you can have thyroid abnormalities, excess alcohol intake, as well as obstructive sleep apnea. Well, atrial fibrillation can affect you in a variety of ways. And if your heart rate, like we've discussed, goes too fast, you can feel palpitations. And if it goes really fast, you can also have chest pain. The thing that worries most doctors in general, most heart doctors in general, is the risk of stroke. As we've talked about, the risk of stroke goes high when you have atrial fibrillation because of stagnation of blood flow. And the biggest problem that we clinicians worry about is that clot going to the brain and causing paralysis. This answer may vary based on the patient, but there's different modalities and treatment options available to patients, and you may want to talk to your doctor about that. But this could range from electrical cardioversion, where we shock the heart back into normal sinus rhythm, and we have different medications that we can use to control the heart rate if it does go excessively high, as well as we can use medications to switch you from atrial fibrillation to normal sinus rhythm. Now, these medications are to be used by a cardiologist, so it is better for the patient to seek care with a cardiologist for such treatment options. Then you have treatment option in terms of anticoagulation that depends a lot on your score. There's a scoring system that we calculate that assesses your risk of having a stroke, which is called the CHADS-VAS score. And based on that, we have different options, including starting from aspirin, as well as higher anticoagulation that includes warfarin, Eliquis, Xarelto, and Pradaxa. Now, these are different treatment options that is best reserved talking to your clinician. The idea of this topic for discussion today is to get the information out there so that patients are more aware of their body and whether or not they're having any of these symptoms. It is important to make sure that we limit the amount of alcohol, because it is a well-known trigger, excess alcohol, as well as making sure your thyroid and sleep apnea and all the stuff that we can do to prevent things like this from happening are taken care of. And also, if you do have any of these symptoms that may be coming from atrial fibrillation, that you seek your doctor and get an EKG and understand what your risks are.